Welcome everyone to the MDI Health Hour. This is the second webinar in a series of multiple webinars planned for the general public. And my name is Dr. Asim. I'm going to be your moderator. I'm a practicing family physician in Calgary. As you have noticed last week, we have a very interactive session for the webinar that we have done successfully last week. And today we are going to do the second part of the webinar, and it is going to be based on COVID-19. Today's topic is protecting our seniors in long-term care and in the community during the COVID-19 pandemic. And we are very fortunate to have uh, two very respectable as well as very renowned panelists. Our first panelist is Dr. Yasmin Majeed. She is a person who is very well known in the community and wears multiple hats. A brief introduction is very difficult for her, but I'll try to cover as much ground as possible. So she is an assistant clinical professor in the University of Calgary. She's a family physician as well as a palliative care physician. She's also a consultant for pain physician for the Calgary Chronic Pain Center. She's president for the AMA Pain Society. And she's also the founder and president of the Canadian Global Care. She's also heading the the lead age care for the different sites of different medical sites for AHS. So her valuable input is going to be very important today. And our second guest is Dr. Ayesha Saeed. She's a graduate from Medical College of Rawalpindi, Pakistan, and she did her residency of family medicine in Calgary. And she from the class of 2009, and she's been practicing for the last 9 years. Her spectrum includes geriatrics, and she has been working with seniors living either independently or in residence centers of the last 9 years. Thank you both of my panelists for joining today. Assalamu alaikum, everyone. So COVID-19 has been the word that has been embedded in all of our memories and all of our heads for a very long time now. Since last 3 months when we first heard of this condition, COVID-19 has been discussed in different and various forms. So today we are going to discuss another important topic. And Dr. Yasmin, would you be able to give us a little bit of an idea as to what COVID-19 is?
So first of all, thank you very much for having me. It's an honor to be presenting and talking to you today and your group. We've all been hearing a lot about COVID-19. So I will just give you a brief introduction of what COVID-19 actually is. So as we know, it started in a small province of China. Wuhan is the place where it was first noticed. How did it get how did people start getting infected? So it's understood and it's thought that it's been transmitted from a bat to human. So it's a virus that goes from animals to human and then back to animals. So this was a bat. It does not happen from drinking bat soup or eating anything. It got transmitted through some contact. So China reported a number of cases on December 31st to the World Health Organization. And by it was on March 11th that a pandemic was declared. It's a pretty serious situation because this virus has traveled all over the globe. And there are a lot of theories that how it could have been stopped, but there's no point talking about that anymore. The most important thing right now is how we can prevent the spread and how we can really contain it until we get a vaccine developed. Right now, there is no cure for it, there is no vaccine, and there's no immunity. So that's why we are in the situation that we are in right now.
Thank you so much for that. It's interesting that it's the whole concept of how the condition originated and how it spread throughout the world has been so fast that now from China, it's here in Canada. And we are seeing quite a lot of people suffering from it. We've been hearing a lot on the news about this term called flattening the curve. And a lot of people in the audience actually who are non-physicians, it's a very difficult concept to understand. And I think Dr. Aisha, if you could actually shed some light on this flattening the curve, it would be very helpful for the audience.
Sure. Thank you, Dr. Asim and MDI, for inviting me to speak on this forum. Definitely. So I want to start by saying that normally what happens in our hospitals, in our healthcare system, is our hospitals are already running on 100 to over 100% capacity. So what that means is that we are already hospitals are already filled, like almost 100%. So what happens is with COVID, because it's so contagious, that if one person get infected, they're going to infect two or more people before they figure out that they have symptoms. So it spreads very fast. And what that results into is a lot of people getting sick around the same time. So if you plot that against a graph, it will give you a big spike where numbers just rise exponentially. And so what happens is that if all a lot of people start getting sick at the same time, it overwhelms our already overloaded healthcare system. So by flattening the curve, what we mean is that by um, implementing, frequent hand washing or physical distancing, what we're trying to do is prevent a lot of people getting sick at the same time. People are going to get sick, but we are just trying to space it out so as to not overwhelm our healthcare system. So if people are getting sick at a steady pace, then it's easier for us to deal with people and provide them the appropriate kind of care they need in the hospital. But if everybody gets sick at the same time, then there's no way we can handle people and provide them the kind of care they need in the hospital at the same time. So flattening the curve means that we're trying to avoid that spike, everybody getting sick at the same time. If people get sick, at a steady pace, then it's easier for us as healthcare professionals to provide appropriate care. Now, the important thing to understand here is how do we flatten the curve, and that's by um, from a physician's point of view, we are offering more testing to people. We're doing contact tracing. So we pick up people who don't have symptoms yet, but they might be carriers, and then we're trying to encourage people to isolate, to go into quarantine. And as a citizen of Calgary, what we can do is frequent hand washing and social distancing, which has been retermed as physical distancing. And the other important thing to understand is where we keep talking about, oh, maintain social distance, maintain a distance of 2 meters. Where does that 2 meter come from? What is the science behind it? So different studies have shown that when you cough and sneeze, you spread your germs into a radius of about a meter around you. And then most of those germs, they stay in the environment, depending on the particle size, from few minutes to up to hours. So if you maintain a safe distance, let's say 2 meters from somebody, your chances of picking up those germs are less. So from we should all be practicing hand hygiene and cough and sneeze etiquette. So frequent hand washing, cough and sneeze in your elbow. But at the same time, if you maintain a safe distance, your chances of picking germs up are less.
Thank you so much for explaining. Now, I hope a majority of our attendees understand the concept of this 2 meter distancing and flattening the curve. Thank you, Dr. Aisha. Now, I'm going to talk a little bit about the most vulnerable population, and that's why I think we chose this topic particularly. That there are two sets of groups of people who we are seeing that are getting sicker more and are requiring a lot of hospitalization. And as days are going by, we are also hearing the word long-term care facilities a lot. Now, I don't have a lot of experience with long-term care facilities, and a lot of anxiety has been coming around these facilities as to what they are, what sort of people they are living there, and obviously with them being more vulnerable, Dr. Yasmin Majeed has a lot of experience with that. So my first question to you, Dr. Yasmin Majeed, is long-term care has one of the most vulnerable population, and what are the basic challenges faced for this group of patients?
So that's a very loaded question. But I'll give you a brief introduction on what long-term care is. So long-term care is a space which is run by AHS in cooperation with private owner operators. And this is a place where we have our seniors. There is no particular age limit, but generally over 65 who need more care. So this is the population that has a lot of comorbidities in general, and they need care that cannot be provided at home mostly. Um, so that's one thing about them. So they need healthcare aides, they need physicians, they need nurses to give them medications. Some of these people have dementia, and that's another challenge that adds to care for that population. So the basic thing with this population is that they are more at risk for any infection. So we've heard about outbreaks not just this time, but we've heard out respiratory outbreaks, GI outbreaks, and these things keep um, attacking this vulnerable population because they do not have much immunity. And that's the basic um, philosophy of have these people in long-term care. I, did I miss anything? Is there anything else
No,
that?
I think Dr. Yasmin, you covered the description of long-term care, because we've been hearing about this so much. And obviously, we're also noticing that the majority of the deaths have occurred from this virus have been in the long-term care facilities. So, what are the precautions that are in place for protecting these patients and staff who are working in these facilities?
So that's a very good question. Unfortunately, this is a novel virus, so we did not know much about it. So so we are being more reactive than proactive. And I think we're getting a grasp on it now. So we heard a lot of deaths in Ontario and in BC in long-term care facilities, and I think Alberta has been more proactive, learning from those facilities. And you must have heard about one facility, Mackenzie Town, that there has been spread of infection and there have been deaths. So we were expecting more deaths because these people were palliative. And once they caught that infection, then obviously they were not able to really get back to the way they were before. So, so what we can do to prevent and what we are doing now is that healthcare workers that we have at these sites, they've been working at different sites. So there is a risk of them transmitting the infection. So AHS has firm policy now that they're only supposed to work at one site. They are advised to wear masks. And also when they're caring for any person who has been declared as COVID positive, they have to wear the proper PPE, like with the proper N95 mask, gown, and health headgear and eye coverings so that they protect themselves from getting the infection. So there are a lot of procedures and policies in place. And I think in Alberta, we are ahead because even though we had one outbreak in one facility, and some facilities are being declared an outbreak because they have had one healthcare staff tested positive, they are really working hard to minimize that spread. So that's basically one thing. The second thing that they're doing is limiting physicians even visiting the sites and families so that we don't get the carriers to take the infection to this vulnerable population.
Thank you, Dr. Yasmin. I'm so relieved to hear that, we as Albertans, we have been proactive and our numbers are significantly down. Now, with that being said, obviously similar sort of a model is present where a lot of communities, they live in joint family systems. And obviously they are also elderlies, they do have medical conditions, and they have their own challenges. Dr. Ayesha, would you like to shed some light and see what are the challenges basically part where people living in community and they are living in joint family system, how would they be similar or different from long-term care facilities?
I think not much different. The biggest challenge is how to protect yourselves when you go out for essential services, as well as how to protect your, parents or grandparents who are living at home. And again, the basic measures are the same. Limit non-essential trips outside the home. When you're home, frequent hand washing. As you come inside the house, make sure you take off your shoes and your jackets and hang it in a designated area like a closet close to your entrance, and basically just focusing on prevention, because like Dr. Yasmin said, we don't have a cure or any vaccine yet. So focusing more on prevention, and trying to isolate or separate the contact if you have symptoms yourself.
Okay. Now, obviously, with long-term facilities, Alberta Health has some control with regards to how policies are driven. People living in the community, they're solely relying on other family members living in the same household. So, apart from, what are the basic steps? If I had my grandfather or grandmother living in my house with me, what should I do? Should I not speak with them? Should I not have dinner with them? So, when you say about contracting and transmission, what do you exactly mean? And what steps are those?
So for example, so if let's pick a scenario where you don't have symptoms yourself and there's nobody at home who has suspected COVID symptoms. So the first thing to do is, like I said, social distancing. So if you are going out for essential services, for example, groceries, make a list, and when you go out, make sure you bring in enough food to last you a couple of days or even a week or two. I'm not promoting hoarding here, but the idea is that don't go out every day for one little thing. So make a plan, make a list before you go out. And when you go out, make sure you're using all the precautions, that you're not mingling with other people, that you're keeping safe distance. You're wearing a mask. Even a homemade face mask is providing, like we're recommending it. It provides some protection. And when you come home, you don't have to not speak or see your parents. You just make sure that when you come home, you take your shoes off, you change your jacket, you wash your hands, and then you can go about your everyday business around the house. And if you have an elderly person who has very advanced age, like more than 75 or older, and they have an underlying condition like diabetes or high blood pressure, then for sure, I mean, it doesn't hurt to take extra precaution, like wearing a mask around them, because you never know. The symptoms are not apparent right away. So you can have the virus and not have any symptoms for 4 or 5 days. So in those cases, make sure that you yourself wear a mask, or if you have to cough and sneeze, do it in the elbow. If you use a tissue paper, use it once and then discard it. And I can't stress enough the importance of frequent hand washing. Just using plain soap and water. You don't have to have a hand sanitizer. Soap and water is preferred. So these are some of the measures that you can do, or you can have a person who's designated, like instead of everybody leaving the house to do groceries or whatever is needed, you can have one person designated for all your outdoor chores. So that way you can also prevent or minimize the risk of exposure to people who are more vulnerable inside your house.
Thank you, Dr. Asha. That was very informative. And I'm sure a lot of people have taken some notes down about the steps that you've suggested or some important things you've suggested. Now, this takes me down to long-term care facilities. Now, this is, you've suggested, Dr. Asha has now suggested how people living in the household and other family members can take precautions and stuff. So my question is now two-part with Dr. Yasmin, that if I am a staff and I'm working in the healthcare facility, as a staff, going into work as well as coming home, what are the steps that I can take or precautions that I can take to prevent the spread of this condition to other staff members or to my home? And also, with a lot of the long-term facility staff has been getting infected, I may have a little bit of a scare or anxiety going into work. What are your thoughts on that, Dr. Yasmin?
So that's a very interesting question. First of all, let me tell you that at long-term care sites, we have proper screening measures in place. So whoever comes in, whether it's me or any healthcare worker, they get their temperature taken. They have to fill a questionnaire, answer all the questions so that they have not been in contact with any person who's positive with COVID. They don't have any symptoms like running nose, sore throat, or a cough or shortness of breath. So they have to fill the form, sign it, get the temperature taken, clean their shoes. And so that is one way of protecting the residents. Secondly, once they are on their shift, they're supposed to change gloves when they take care of a resident. or if there are certain residents, for example, they are in isolation. So anybody, any long-term care resident who has any symptom like that, even a running nose or a cough, they are immediately put into self-isolation and they are swabbed. So with those people, they will use proper precautions, proper PPE, so gown, mask, gloves, everything. So that will help prevent the spread of infection to other residents and also to themselves if the patient or resident is COVID positive. So they will be isolated completely. And so your question is very valid, that if these nursing staff are hearing all these stories about spread of infection, and so why should they not be scared or afraid to go to work? So the answer to that question is that, as you know, even in ICU and emergencies, doctors are working and they don't necessarily get the infection if they are protected properly. Like if they have the proper PPE, then they are protected. Same thing with this population. So they have been given, we have all the PPE equipment there, and they have been trained how to use it. They have been trained to change their gloves between each encounters and to how to protect themselves with a mask. So basically, I can reassure people who are working there, or if you know somebody who's working there, that all precautions are in place, just as they would be in hospital. So that is something that as healthcare workers, when we join the profession, whether we are physicians, whether we are nurses or healthcare workers, we have an obligation. So we can't back off in this time of need. Having said that, obviously we need to be protected. And so that's, I hope that answers your question. One thing I want to add, when we talk about symptoms, some of the elderly present with atypical symptoms that we've seen in Mackenzie Town, where you heard about the outbreak. So some of them had no usual upper respiratory tract symptoms. They only had a urinary tract symptom and they tested positive. So just a little information on that.
Well, that's very interesting because we hear is the cough and the cold and the runny nose and the fever. So thank you, Dr. Yasmin. That's very insightful. Now, you mentioned that there are steps and precautions that are in place. So I'm going to take this question again to with Dr. Ayesha, that if this was a similar situation at home, that you had somebody who now has COVID-19 positive and they have elderlies in the house, what are they going to do? How are they going to protect the elderlies in the same household? What methods and measures can be taken to prevent the spread of COVID-19 inside the house?
Sure. So I'm going to share this handout. This was originally set out by in Ontario, but it's very valid here as well. And I'm just going to walk you through some of the points here. So first of all is frequent hand washing. So if you have yourself have COVID-19 symptoms or you're looking after somebody at home, these are the precautions that you can take in order to be safe yourself and effectively provide care for your loved ones. So first of all is wash your hands. So frequent hand washing. Wash your hands, I'm going to say even every hour, and wash it properly. Now on this handout it says 15 seconds, but we're actually saying wash it properly for at least 20 seconds. And there are very good YouTube videos available where they can show you what a proper hand washing looks like. So I will encourage everybody to watch that video. If you are in a situation where you can't wash your hands with soap and water, by all means use alcohol-based sanitizers, because alcohol seems to weaken the virus, the walls of the virus, and it's just not as effective. And then you have to wear mask and gloves. So just like in long-term care, where with proper PPE or personal protective equipment, you can prevent the infection, the same principle applies for providing care at home. So wear a mask and gloves when you have contact with the person and any of their bodily fluids, for example, saliva or the blood, the vomit, the urine, the feces. So wearing is very important. And then how to dispose of that glove and mask is equally important. So when you take the glove or the mask off after you have provided care, you dispose them off in a waste paper basket, which is lined with a plastic bag. You don't have to have a special garbage disposable system, but you can use the regular garbage bag. And if you're using a waste paper basket, paper basket, make sure that it's lined with a plastic bag. You take off your gloves first, and then you clean your hands with soap and water before you even touch your face with or trying to take the mask off. Because if your hands are not clean, then if you touch your mouth, your eyes, your nose, those are the places where the virus can get into your body and infect you. And once you've taken your mask off, you again wash your hands with soap and water before you do anything else. Then limit the number of visitors in your home. Now, if somebody is tested positive at home, or you yourself, there shouldn't be any visitors coming to your home. You should be in quarantine. You should be isolating yourself. And especially if you have any person who is senior with chronic medical conditions in order to prevent the spread of infection. Few words about avoid sharing household items, which most of us don't think about it, but don't share dishes, drinking glasses, cups, eating utensils, towels, beddings, or any other items that the other person who has COVID-19 symptoms or they're under investigation, they're using. So keep everything separate. And after use, wash their utensils or all the items they've used very thoroughly with soap or detergent. Now, you don't have to use a separate or a special kind of detergent. Whatever regular soap and detergent you're using is good enough. Washing clothes or dishes in dishwasher and washing machine is also it's fine. And don't share cigarettes. Now, cleaning around the house. So there's a term we use, high touch surfaces. So surfaces like door handles or countertops, they're considered high touch surfaces. To wash them or clean them frequently, every hour to 2 hours. They should be wiped down thoroughly with any household cleaner. What about the laundry? So you wash the laundry. Everybody's clothes can be washed in the same load. You don't have to use a special detergent. But when you're handling the laundry of a person who's infected, please wear gloves. And again, you throw their clothes in the laundry. You take the gloves off, dispose it off properly, and wash your hands. Um, and be careful when you're touching the waste. So all waste, like I said before, can go in the regular garbage bins. You don't have to have extra precautions. But when you're emptying waste baskets, make sure you don't touch any used tissues with your hands. The other thing that helps is lining that waste paper basket with a ordinary plastic bag. So you're not physically removing everything from the bin and emptying it. You just tie the knot and throw it in the black garbage bins. And again, make sure to clean your hands after soap and water once you've done emptying the waste basket. So
Thank you,
basically, a lot of emphasis is on hand washing.
Right. Thank you, Dr. Ayesha. That's very informative. So as a summary so far by now, we know what COVID-19 is. We understand the concept of COVID-19 in long-term care facilities. We understand how we can prevent this and what are the necessary precautions that we've taken. So I'm going to take everybody to the second part, which is some terms that are being used quite regularly by their family physicians called goals of care. And I'm sure that a lot of discussion has already happened with some of the patients with their family members. But Dr. Yasmin, would you like to shed some light on what this term is, and from a general viewing audience, what is the relevance of this with regards to COVID-19?
So goals of care is not something new that came into existence with COVID-19. That is important to understand. Goals of care is something what we would want for us or our loved ones at the end of life, or if something happens. It's more relevant in terms of when people get older, because there are some things that will work for them and there are some things that will not work for them. So if it's a young person, for example, and their heart stops beating and we do a CPR, there is a greater likelihood that they will survive that. And once they're connected to a defibrillator and then taken to the ICU if need be, so they have more likelihood to survive. People, when they get older, since the perfusion is already low, with the arteries getting narrow, the CPR can be done, but it may not be successful. In fact, it may harm them because if they're frail, you may end up breaking their ribs, and they may still not survive the whole thing if you take them to hospital. So basically, the whole idea is to have this discussion with patients before anything bad happens. And family physicians can play a very important role in that. It's a very difficult discussion, but it's how you approach it. So if you approach them by just saying that we want to know this because we don't want to do anything that you may not approve of for your loved one, or they might not have liked, right? What are their values? What would they like to be done when this happens, like their heart stops beating? Would they like to be attached to machines, or would they like to be treated conservatively? So it's not like we are letting them go, or we're making this decision because they have COVID-19. It's because of all the multiple comorbidities, and they can be attached to machines, but are they going to survive that? Is that what they want for their loved one or themselves? So this is a discussion that we have, and in Alberta we have um, goals of care such as R, M, and C. So R is for when you want all the resuscitation to happen. M is medical management only, and C is comfort care. Now, when we say comfort care, that doesn't mean that we leave that resident on their own and don't do anything for them. We do everything that will keep them comfortable, except that we send them to ICU and get them attached to machines. So that is a discussion that should happen way before anything bad happens. Having said that, this is a really critical time when we are having these discussions with our residents whose goals of care are not comfort care. So they are medical management only. And this is when you approach this topic and explain things properly, people understand. It's not like we are abandoning their care. We are just giving them the best care that they would appreciate at that time, and that will work for them. Because many studies have shown that the elderly do not survive this ICU, right? And so it's for their dignity. We don't want them to suffer. So we don't want them to have broken ribs and live in pain and yet not be able to survive. So that is the basic. It's a separate topic that we can have a discussion on another time. But this is the basic gist of it.
Thank you so much. I think that you explained it really well, Dr. Yasmin. So in your words, if I wanted to have my goals of care discussed, I should be having that conversation with my family doctor as well. That, if I want to go, this is the treatment options that is available, and the best possible scenario and the worst possible scenario will be discussed between me and my family doctor. Is that right?
Yes, absolutely.
Okay, so it's got nothing to do with COVID-19. Thank you so much for that. So will that apply to community-based physicians, Dr. Ayesha, or is it for long-term care facility patients only?
No, it's very valid for all your patients living in community. And like Dr. Yasmin articulated, summarized all the goals of care very well. We call it advanced care planning. And the whole idea is to discuss what your patient's wishes are under non-emergency situation. So if you find them in a situation where they're not conscious, they've passed out, you don't want to revive somebody who doesn't want to be revived. So it's all part of advanced care planning. And definitely, we need to update all our patients' goals of care now in this COVID-19 environment, because the last thing we want as physicians is having to decide on our own whether there's two patients, which patient to intubate and which patient we're not supposed to intubate. So as community physicians, we need to get these conversations started. And if we just like living in Calgary, we can talk to our elderly, we can talk to like get the conversation started at home. And I wanted to share a community resource. It's called Plan Well Guide, and this is their website. Let me see if this is the right one. So planwellguide.com. So I will encourage everybody, whether you're a physician or whether you are just somebody living with a senior like parents or grandparents, to explore this website under resources. They have explained it in such simpler terms about what goals of care are, what are these conversations. Goals of care doesn't mean that you're planning for your death. You are just planning for what kind of care is acceptable to you and it explains it in a very simplified language. I encourage everybody to review or at least explore this website. And just to expand a little bit on what Yasmin said, that if you're a person who's 80 years old and you have been admitted into the ICU, your 50% of those people die within 1 year of being discharged from the hospital, the ICU. And 25% of those patients who survive, 25% of those, they are left with, they don't get to back to their baseline. So they have no quality of life left. And only 25% of those people who get into ICU are able to get back to their baseline. So it's all about making informed decisions, not doing interventions which are harmful, which are not evidence-based. And I really encourage everybody to explore this website even before and it's okay to talk to your physician about, listen, I heard this about goals of care. Can you help me? Can you guide me? There's so many resources available. And this forum, we just don't have enough time to just talk about goals of care, but I encourage everybody to explore this website.
Thank you so much, Dr. Ayesha. So I know we're running a little bit short on time. So I'm going to bounce one question, which is going to be our last question before we move on to our question and answer sessions. And this question is a little bit more difficult because we can expand on it all day long and still won't be able to come up with a very concise answer. But a lot of people are asking this question: how do you plan, or how do you address the psychological challenges with people that are suffering from COVID-19? So this could be challenges faced by the residents in a home. This could be from the staff. This could be from family members. So Dr. Yasmin, what are your experiences in long-term care from psychological side of things and engagement side of
So
things?
this is a very heartbreaking situation, which we have never experienced before, because we have to actually ask families not to visit, whereas it was just the opposite before. We would always encourage family to visit. So this is a very difficult situation, not just for the patient or resident in long-term care, but also for the families, because they can't see their loved ones, whether they have COVID-19 or not. And even though it's for their protection, it still causes a lot of anxiety, and it's difficult to comprehend. So I feel for them, and at the same time, we don't have any other options at this time. So one way to alleviate that anxiety and to deal with that situation is we encourage our families to communicate with each other through FaceTime. So we have made that technology available. So all residents have that facility in their rooms, so they can see their loved ones, talk to them, and feel that their presence virtually. Um, Other than that, it's the general COVID anxiety that prevails everywhere. This is difficult because you can't see their loved ones, your loved one. But I think with at least we are lucky and fortunate that we have that technology that we can see people virtually. So I think that's something that we are working on. They may have, like, we don't know what will happen in the future. Right now, we're trying to just manage the situation as it is, but as things progress and as things settle down, we will have a lot of other issues that we will have to deal with in terms of psychology from families who have not been able to see their loved ones and they passed away. Those are things that will have to be dealt with, and we will need more support in terms of psychology and counseling for those.
So this takes me, the question now goes to you, Dr. Ayesha. So do you see the same challenges in the community as well? And is there more resources available for people living in the community with psychological challenges?
I want to start by saying that social isolation among older adults is considered a serious public health concern. So on one hand, we are telling our seniors to have their groceries delivered, have their medications delivered, no in-person visits with their loved ones. And on the other hand, we know that the social distancing, social isolation increases the rate of depression, it increases anxiety. So these are unprecedented times. Before COVID started, through our primary care networks, through our rec centers, there were a lot of programs available for seniors to engage in. So now what? We want them to just stay indoors, and then we are definitely seeing increase in anxiety and mental health issues in our seniors. So some of the suggestions that I have, or some advice for or older seniors is, again, it all starts with embracing healthy lifestyle. So what does that mean? Have a schedule in your life, right? Have a same wake time and sleep time, like go to bed at the same time, wake up at the same time, exercise regularly, eat well, avoid too much alcohol or drugs, and limit the news consumption. Like, don't go and just sit in front of news channel all day, because nothing good will come out of it. It's going to worsen your anxiety. Get an update maybe twice a day for about 15-20 minutes, and that's it. And then keep yourself busy with activities that you enjoy. It could be reading a book, it could be going out for a little walk while maintaining social distancing. And for some of my patients, what I have done is ask them to make a list of their family, their neighbors, even their physicians, or all the healthcare providers. And if they feel that they're not doing good, that they're feeling depressed, or they're starting to get more anxious, it's okay to give those people a call just to say check in. Or it's okay to say that, listen, I'm not doing well, can you walk me through it, or can you just provide me with a little bit of company for a bit over the phone. And we have to remember that these are unprecedented times, and it's okay to not be okay, because traditionally we are very, we just say, every time when somebody say, oh, how are you doing, we say, oh, we're good, how are you? Good. But it's okay to say, listen, I need some help, I'm not doing okay. The other thing is that if you are a senior individual who is lucky enough to have some extended family, you're living together, then just engage your older adults, like sit with them, thank them for all the love and support they have provided you over the number of years that you guys have been together. Because I mean, it's all about making them feel valuable members of the family. And for a younger people who are living under the same roof, try to engage with older adults. For example, ask them to share a favorite recipe with you. If they're into cooking, get them to help you to make something, their favorite dish, for example. Or at the end of the day, ask them to retell a story about their life. Maybe they have faced some adversity in their life, how they faced that challenge, what made them stronger, how did they come out of it. So it's all about connecting, putting the like, connection could be either through a face chat, FaceTime, Skype, or it could be if you're living under the same roof in person. And you know how they say it takes a village to raise a child. I think it's the same is true for a senior population. It does take a village. So if you, family and friends should definitely pitch in, but we as their neighbors, as a community, should also step up. And if you're going for a walk, you can wave to your neighbor, say hi, or just if you have the number, just say how you're doing. Because now we don't have those resources PCNs offered, or RX centers. So now we have to step up as their neighbors and a community. And I think we can be a vital source in providing our seniors with necessary support and help them feel more connected as a society.
Thank you so much, Dr. Ayesha. That was very wonderful, very good advice. Now I'm going to open the questions and answer session up. And I believe a lot of questions are coming for healthcare workers, and I'm sure Dr. Yasmin would be the best person to answer that. The common theme that I'm seeing in a lot of these questions so far are that, what are the precautions adopted, and do we actually screen healthy healthcare workers as well, or not?
That's a very good question, and I've been pushing for it at a lot of our meetings. Um, so there is an argument against it as well, and that argument is that the virus, somebody can test negative in the first few days if you test them, and then they maybe become positive. So there is no guarantee that if you test a person negative, they will not become positive. So that's one reason for not opening up to all healthcare workers. And so at this time, we are not testing all healthcare workers, but like I said, we are screening them before they enter. We are limiting their work to one site only. We are encouraging them to wear masks. and teaching them proper hygiene, so that sometimes when you wear gloves, you feel a false sense of security, but even with that, you can't keep touching other things. So all those education sessions are ongoing. So even though we are not testing all healthcare workers at this time, we are still monitoring the situation very carefully. So even with the slightest symptom or exposure, we are not letting them work in that facility.
Thank you so much. I'm sure this would have answered a lot of questions, because certainly this was also in my mind that, as a healthcare professional, should I be getting that tested or not? And I'm glad that Dr. Yasmin, you're our advocate to Alberta Health, and you're pushing toward this. And it's nice to have a familiar face fighting you in your corner. So I'm so impressed with that. Now this takes me to Dr. Ayesha. So when you say health people living in homes, obviously you have some elderly parents where home care is coming to visit them, or there is other healthcare providers that could be visiting your family, like the physios or something like that. What are the precautions they should be taking, and what are the steps that they should be doing in order the family should be doing when they're encountering somebody from a healthcare team to visit their house?
I think I'm not sure if any physios are coming. They're trying to limit all the visits to essential visits only. But if there is a need where you have to go in and provide care, for example, if you're palliating somebody in the community, then it's ideally it should be full PPE, which means that you should have a protective gown on top of your regular clothes, face mask, a shield, and gloves, and that it should be limited to one PPE per encounter. You can't just wear it, and go and visit several people, because that defeats the purpose. So from healthcare professional point of view, PPE is very important. And from if people are coming in, make sure that they don't have any symptoms, that they're not sick themselves, because then they're bringing all the germs in. And if somebody comes in, they should just come and visit the person who they're wanting to see, and then leave. Like, don't everybody start, make a cup of tea and everybody sharing and having a little party. That shouldn't be the case. But just come in, do your thing, limit it, the visit to what is necessary, what needs to be done, and leave. And again, frequent hand washing, use homemade face masks. So just some suggestions to be extra cautious.
So thank you so much for that. Now, Dr. Yasmin, I have a question for you in the capacity of your expertise as a family physician as well. I've been asked this question a number of times, that since the goals of care have a certain discussion, would it be worthwhile for everyone or family physicians to be engaging again with their elderly population or senior population and start having that discussion?
Absolutely. This cannot be overemphasized. I think it's really important. And now that we are doing phone consults, I think it may be an opportunity to connect with all your senior patients who are not in long-term care or who are not sick, and just opening up that conversation. Not to scare them, but just to get an idea of what their thoughts are on that, and what kind of what they envision for themselves, right, in the future if something happens, so that we don't do something that they would not like to be done to them. So if you approach the conversation in that respect and make it about them rather than about what you think is best, they're more likely to engage and more likely to come to a proper conclusion. And you don't have to decide in one conversation. You can open that up and say, okay, why don't you discuss it? Why don't you, we can talk about it again next week or at another time.
So in your experience, then with certain communities like the Muslim community or some other different communities, are there some challenges, and what is your experience with responses from goals of discussion in this diverse population?
So unfortunately, not just Muslim or Pakistani community or Indian, I've seen a lot of resistance from other communities, some Asian, Filipino communities as well. They have their very set practices. So sometimes it's very challenging to even open up that door. But I think the most important thing is that you need to convince them that you are on their side. You will not abandon care. You're not saying that you will not look after them or you will not provide the care that they need to, as they uh, reach the end of life. So once you gain that trust, I think important thing is to build trust. If they trust you, they will accept things slowly. So yes, it has been challenging. There is a lot of resistance, and especially in our communities, we stay in denial. We just want it to happen, and then we say it happened. But when the time comes, and then the EMS are there, and they need to know what to do, right? So I think if you present it that we do not want to do things that you may not have liked or the person may not have liked. It's not about even the family, it's about the individual. And I think everybody deserves to have that dignity to make their decision themselves, and not sometimes we struggle with what the family wants. But I think it's really important if those things are clarified with that individual themselves.
Thank you so much, Dr. Yasmin. I certainly have had occasions where it was a very difficult conversation with a patient, and I really appreciate. And hopefully, we will arrange something in detail about the goals of care, because from both of your experiences and conversation, it looks like it's a fairly vast topic, and I would love to have a conversation in length about this as well. Now, going to our next question, the general theme that I'm getting is, and I'm sure that you've heard this plenty of times, that alcohol versus hand washing. It's like a general question that people ask, and because we are running out of hand sanitizers. So Dr. Aisha, would you like to shed some light on this, that is alcohol sanitization better, or is hand washing equally good?
Actually, number one recommendation from WHO is soap and water. And soap and water and washing, the duration is also important. So soap and water and washing your hands for full 20 minutes, trying to get in between your fingers, around your thumb, around your wrists, and so that's actually superior. Alcohol-based hand sanitizers, in a situation where soap and water is not available, or let's say you are driving or water is not around, then alcohol-based sanitizers are effective, but they're not superior to soap and water. Soap and water is superior to alcohol-based hand sanitizers. And then you hear all sort of hand sanitizers with treaty oil and all sort of natural organic stuff. And it's the alcohol in those hand sanitizers which are effective against weakening or breaking that, the structure of the virus up. Anything other than alcohol, not effective. So number one is soap and water. Number two is duration of hand washing is also important. And then number three is alcohol-based hand sanitizers.
So now for all the audience who's listening right now, so you have water, you have soap, 20 seconds. I think the discussion here is kind of very clear that washing hands is our first choice. If we are not able to get a hold of soap and water, then we can use hand sanitizers. Thank you so much, Dr. Ayesha, for that. Now, the PPE, or personal protective equipment, has been discussed a lot in different forums and different conversations, and certainly Dr. Dina Hinshaw, our CMO, has been stressing a lot about protective gear for the medical staff. And we are hearing some news, horror stories from across the world that people have got infected. Now, when it comes to PPE, Dr. Yasmin, what are we talking about? What is a simple surgical mask versus the N95 mask, and how does it actually stop the spread of the virus?
So the N95 mask is a specialized mask that prevents aerosol generated droplets from so it's generally advised to use that when you're doing any aerosol generalized procedure. For example, what is that? What are those procedures? So those procedures are like, for example, if somebody has a CPAP on and they are in long-term care, or BiPAP. So they are non-invasive ventilation things that we use for people who have obstructive sleep apnea, right? For example. So if somebody has that, even at home or in long-term care, and if you're taking care of that person, then you have to wear a proper N95 mask. That's basically the difference. In our day-to-day prevention thing, we do not need an N95 mask. We can do with a surgical mask or even a cloth-made mask, as now being recommended in our day-to-day activities. Obviously, when we are in long-term care, we're using surgical masks for our staff. So I see a lot of people wonder, what is this mask doing? Is it actually preventing the infection from coming to you, or is it preventing the infection to go to others? Mm-hmm. So basically, the main goal is that if somebody's sick and they're wearing a mask, they are limiting that transmission to other people. That's the main thing. Having said that, if you're in a site like in a grocery store or outside, and somebody has coughed or sneezed, that will protect you from catching those germs as well. And sometimes these droplets can last for even an hour, right? So if that person is coughed and gone, and so social distancing is important, but there's nobody to social distance from, but you're there. So that's why finally now we are getting this advice from the CMOs that we should be wearing masks. They are not 100% guarantee. We still have the hand washing as the main prevention thing, but they are supportive. And so I think that's the answer to that question.
Thank you so much for that, Dr. Yasmin. Now, I've had an interesting question here for Dr. Ayesha. There's some homes which have the luxury of having attached baths, and there's some homes which don't. So in that circumstances where you have a patient who is going to go into quarantine because of the COVID-19 and there is not enough bathrooms or attached bath with their room, is it safe for them to be using the same bathroom as normal other members of the household? And if you are positive and you're waiting for the results, should we carry on with the same practice until we find out if you're positive or not?
So that's a very good question. So if you are lucky enough to have a separate bedroom with an attached bathroom, ideally that's where you should self-isolate or quarantine the person who has COVID-19 symptoms. If that's not possible, then the person who is awaiting his results or they have symptoms, then you need to again come up with a plan. So that person should either that person should be the last person to use that washroom once everybody else has used it. And again, we have to clean the surfaces. So once that person who is either suspected or have COVID-19 symptoms, after they've used the washroom, which is shared, it needs to be cleaned properly. So all the touch surfaces, the door knobs, the flush handle, the vanity, everything needs to be wiped with an alcohol-based wipe. And every time they use it, you have to wipe the touch surfaces. There's no other way around it.
Okay. Thank you for that. Now, Dr. Yasmin, another question for yourself, and I'm sure that we've heard this before. The virus stays alive on different surfaces with a different time duration. When people are visiting home care facilities, moving groceries, sometimes food items with them, or even staff when they're bringing their own stuff from home, they'll be having their own personal equipment that they'll be carrying, like a purse or a wallet or a bag, something like that. So what are the risk of transmission with these substances? So if groceries, bags, plastic bags, and other things.
So that's a very important question as well, because this virus is different. It stays alive on surfaces. So even on a regular surface, it can stay alive for about 1 day to even 3 days. So if you're bringing any bags, it's better to dispose them off before you bring them in the house. You should have wipes right where you have a wash basin. When you enter your house, you wash your hands. There should be a wipes, or you can use soap and water to clean those bags if you're taking them inside. If there are any packages that are delivered to you, make sure that you use wipes to clean the box. Some people may still be ordering food. So if you get those boxes too, it's better to use gloves, wipe the box, take your gloves off, and take the food out of the box and dispose of the boxes. As far as handbags and stuff are concerned, it's really important. We are encouraging our physicians at long-term care sites and even healthcare workers to not bring even their cell phones. They can leave them in the car and their bags in the car. Because cell phones, again, is something that we don't think about too much, but they also can be a source of infection. So either you keep cleaning them, or if you're going to work in a healthcare facility, or you're caring for somebody at home, it's important to leave those items in the car. So the less stuff you have, the less risk you pose to other people.
Thank you so much. Because that's been a very important question that has been coming in my head too. Like, when people bring groceries from outside, should we be leaving them in our garage for a certain period of time before we take them inside? Perishable, non-perishable items. What should we be doing, Dr. Yasmin?
Yeah, so I think if you're cleaning properly, like if you use gloves to carry them and then clean them, wipe them properly, and take the stuff out carefully, leave the bags in the garage. You don't need to bring the bags in the house. Even the boxes, generally the stores are pretty good. They are wiping stuff, but you don't know who's touched it before you, and by the time it gets to your house, the safest thing would be to use wipes on the boxes and not bring bags into the house if you can avoid it. Um, and clean them if you touch them. So the gloves need to be changed. Like, and I hope everybody can find gloves, but in this challenging times, if you can't find gloves, just wash your hands, wipe if you have wipes. Otherwise, use soap and water. So you can don't get paranoid about it. Just make it a routine and do it. Like, I don't want everybody to go like crazy because there's so much going on. But at the same time, if you're careful and you build it into your daily routine, then it will become a natural thing to do.
Okay. Thank you so much, Dr. Ayesha and Dr. Yasmin. Certainly, this was a very informative session, and I've tried my best to cover through the list of questions, but there have been so many. So if there's any questions that have been left unanswered, I apologize. We will try our best to go through the list and see if we can answer them privately or separately at the end. But we're running out of time. So first of all, I would like to really present with a word of thanks to both my panelists for taking time after their busy schedules and coming in on a Sunday. It's beautiful out there. I know you all wanted to go for a walk, but thank you once again, and all the attendees that have come in. So just to give a small summary from what I've heard so far, the importance is, again, prevention, prevention, prevention. We use the term, and Dr. Aisha very rightly explained the word flattening the curve, and that is something that we have to be practicing. The other thing is about what are the necessary steps that have been taken and how the impact is on long term and community for people who are seniors. And I think we covered that ground by going through the conversation. And finally, we discussed about the challenges and the goals of care as well. So I hope this was this was a very informative session, and I am really thankful for everyone once again. Thank you for joining us. We will end our session now, and hopefully MTI will come up with further medical health programs. In the last bit, if there's any one thing both of my panelists, Dr. Yasmin and Dr. Aisha, would like to share, feel free, and then we can end our session after that.
So one thing I would like to say is that I know there may be a lot of unanswered questions. I'm happy to answer any questions that we may have not missed. We may have missed. It's just that we owe a lot to our elders, and I want to tell our younger population, please take care of yourself so you are not transmitting the infection. Even though it's not very common in young, it does happen in young people too. At the same time, don't be so don't take responsibility, and we have to protect our seniors.
Thank you, Dr. Yasmin. Dr. Aisha?
I echo the same sentiments what Yasmin said. I think she summarized it very well. It is our responsibility not only to look after ourselves, but our most vulnerable population. So I know social, physical distancing and all that is hard, but you're not just doing it for yourself, you're doing it for everybody else around you. So wash your hands.
Thank you so much, everyone. And once again, I thank everyone and enjoy the rest of your day and stay tuned. We will be coming up with further health talks in the near future. Thank you so much.